Wanted to just go on and talk about some unusual clinical presentations that we see with ringworm and some of the ways that we can kind of deal with that. Resistant organisms. You can sometimes see a case of ringworm that presents as pemphigus foliaceus, and we'll talk about that in some detail. A failure to develop immunity, persistent infections, and the syndrome of Kerrion that I'm sure most of you have heard about. So we'll go over those one at a time, and hopefully this will be helpful in those difficult cases that you've thought, don't seem to be getting to the bottom of this, where am I going wrong? So resistant organisms. Certainly with Grisia fulvin, we knew that we often needed a very broad dosage range, and this was partly due to the fact that Grisia fulvin was very variably absorbed, and we used to talk about using some sort of fatty food when we were giving Grisia fulvin to help in the absorption. So if you were going at the very low end of the dose rate, it may have been that you just weren't giving a big enough dose to sort the problem out. So often we would increase the dose of Grisia fulvin when that was our drug of choice. We know also that mean inhibitory concentrations can vary between different strains of fungus. So again, one dose fits all doesn't seem to work as well in fungus as it does in bacteria. Although again, in bacteria there can be fluctuations in MICs. It seems to be a more apparent in dermatophytosis. Of course, some animals have aberrant immune responses, so it's not so much about the organism, but it's also about the actual host of the organism. The animal itself doesn't seem to be able to self-cure its ringworm as most animals will. And if you're seeing it, if you're suspicious that you're doing all the right things, but you're still not able to get rid of it, then it is worth changing to a different type of drug. So maybe from itrafungol onto terbinafine and use that as one to have at. But do look at the treatment protocol. If your dermatophytosis case is not clearing up, then you really need to think about, maybe we should clip this cat up, and also look at the environment. And of course, by clipping the cat, we remove such a high infective dose of the fungus that things can start to improve because we've removed all of that infection. Pemphigus foliaceus, cats, you will often see pemphigus foliaceus. It's not a common condition, but it's something that you should be looking out for. And I would suggest a normal caseload, you should be seeing at least one of these a year. Problem with cats is, of course, that they respond so beautifully to steroids. So we see a scabby cat coming in and we're in a rush. It's very natural to reach for the steroid, and quite often these cats will do a lot better. It could have been allergic, it could have been pemphigus, but they will respond to that treatment and will do well. However, we do know that certainly I think it has also been recognized in dogs with Microsporum passicula, sometimes they will get pustules and acantholytic cells in there that make us think this is a pemphigus foliaceus case. But actually, when we send off a fungal culture, or when we ask our pathologist to perform PAS on the histology, then quite often fungal hyphae will be seen. In those cases, of course, don't give steroids, give antifungal treatment, and these cats will do a lot better. And just remember, in a sense, that pemphigus is a symptom, not a diagnosis. We know that pemphigus is caused for many reasons. Obviously, immune-mediated reasons. Some cats and dogs can get pemphigus because of drug eruptions. Occasionally, we've had dogs and cats have problems with food that has caused pemphigus. So it's something that is worth looking at. What could be the underlying cause? Is there a drug in there? Could there be a fungus there as well? So don't just decide, right, this is an immune-mediated thing. This needs lots of steroids and cyclophosphamide. It may need something quite different. So well worth delving a bit deeper in those cases of pemphigus that you're seeing. Failure to develop immunity is quite interesting. We know that dermatophytosis, the recovery is usually associated with a cell-mediated immunity. And this is usually very long lasting. We know that quite often people will only get ringworm once or twice in their life. But in the right conditions, high infective doses, the right sort of humidity, perhaps the person is immunosuppressed or the animal is immunosuppressed, this can lead to a reinfection. Cattle seem to develop lifelong resistance, so if they get it once, they seem to do very well with it. And of course we know that there is a vaccine available for use in cattle with ringworm. We know that in work done in the human field that instead, some individuals, instead of developing a cell-mediated immunity response, they actually develop high levels of IgG titers, and these often develop into recurrent infections. They don't seem to be able to throw off that ringworm in the same way that other people would do. And we also see some individuals who have high levels of IgE, and this is often seen in individuals who are predisposed to allergy. In the work that's been done in cats, obviously not as detailed as in humans, we seem to think that similar things are happening, that there are certainly certain individuals, certain breeds that seem to be prone to persistent infections. They don't seem to fight off the dermatophytosis quite as well. They can be carriers of the dermatophytes. And you know, you can certainly see individuals who are related to each other also being more prone to picking up dermatophytosis. Certainly do look out for those long-haired cats in a situation where you do have dermatophytosis in a group of cats. You don't seem to be able to clear it up. It's almost certainly the long-haired cat that's acting as the reservoir of infection. So look out for your Persians, look out for your Himalayans. So as I said, I think there is a genetic component, as there is in people, and you really need to look at them seriously to get any cattery problem under control. And also in persistent infections, as we mentioned previously, it's always worth checking, certainly on the FeLV and possibly the FIV status. Often in cases where I've seen where treatment isn't going well, when we've checked these statuses, you know, that there is a positive FeLV or FIV status, and this makes the cat much more prone to keeping its infection and not being able to throw it off. So if you have a case of ringworm, if it's not going well, you know, do look at doing a viral panel. And obviously if a cat is on steroid medication because you thought it was an allergic problem, you have to stop that treatment. Carrion is mainly seen in dogs. I think it's only seen in dogs. It's an over-exuberant response to inflammation with the development of a plaque or a nodule. And often we will look at a dog like this and we will think, oh, this has a neoplasm of some description. So when you see it, it's quite often that you've taken it out as a biopsy. You're expecting to see maybe that the dog has a histiocytoma, and it comes back as a carrion. And of course that helps you to know that there's a completely different treatment there. And they do seem to respond quite well to treatment. Environmental control is important. Really the two products that seem to really work are enilconazole, so the imaverol again made by Janssen, or just straightforward diluted bleach. I'm a great believer in being very, very thorough with hoovering. If there are bags in the hoover, you throw those hoover bags away. You carry on doing this probably on a weekly basis, so you're doing it very often to try and really decrease the infective load in the house. And washing curtains, washing bedding, perhaps when you feel that you've got to a certain level, getting the carpets cleaned properly. Anything that will work to try and really clean up that environment, because if you don't clear up that environment and a new kitten comes into the house several months later, it's very possible that that cat can develop dermatophytosis. We know that vaccinations certainly work very well in cattle, but they don't seem to work as well in other species. What we find is that vaccines are often used in the face of an outbreak, and they seem to improve clinical signs. The worry is that the clinician stops too early with treatment, and of course you end up in a situation where the cat is still infected and then goes on to reinfect other animals. So just be aware there are sort of work on vaccinations, but at this point it's not really one that's being used in a general practice sense.